Sabbath. Happy Sabbath. Happy day. My name is Dr. Martha Gatumbu Momanyi, and I'll be giving the health talk today. Today we are going to be discussing about autism spectrum disorders in childhood. And in a nutshell, we can define autism as a complex neurobehavioral condition that leads to impairment in three facets for a child. They are impaired in their social interaction, in their language and communication skills, and they may also have rigid and repetitive behaviors. Some of the risk factors for autism spectrum disease include genetics. So if there is family history of a child with autism, there are higher risks. Environmental toxins such as heavy metals, chemicals and pesticides, viral infections and medications or complications in pregnancy. And autism tends to be more common among boys and preterm babies. Some of the ways you can recognize an autistic child is from very early, from as early as 6 months. This happens like if the child is not gesturing or is not giving you good facial interaction. So a child who doesn't babble or coo by 12 months, does not gesture, that is any pointing or waving by 12 months, and cannot say a single word by 16 months, should be evaluated for autism. If by 2 years, that's 24 months, they are not able to make 2-word phrases, that's another red flag. And if at any point in their development they lose their language skills, that's also a red flag. So for these children, and generally for all children, especially under the age of 5, we advise that when they see a pediatrician, they are screened for developmental delays, especially in speech and communication, from as early as 9 months, then again at 18 months and 24 to 36 months. Thereafter, if the child has suspicious signs for autism, we can be able to do some comprehensive screening tests. So on the management of autism, it involves both pharmacotherapy, so there are drugs for the associated conditions that they may have, like hyperactivity, anxiety, tics, or seizures. There are medications they can have. But largely, autism is managed by behavioral therapy. So there are certain behavioral techniques that we are able to offer children who are autistic. The most common is called applied behavior analysis, where we are able to teach children how to adapt in their everyday lives in a context that they'll be able to understand. We also do social skills training. So that is trying to teach the child how to interact normally with children of the same age and integrate. And then speech therapy is also a core management principle in management of autism. Play therapy. Play therapy is important for children because children require play. And in autism, children tend to play alone. They are not very interactive. So play therapy is a modality that can be used to help them integrate into their normal age groups. Family education and counseling is important. The whole family needs to be aware about what autism is, and they need to be able to provide a consistent structure and routine. For autistic children, they thrive in environments where there is a lot of structure and routine, and it helps them self-regulate themselves. And for the family, it's important for them to be aware of the condition and know when to seek help for specific concerns. In terms of prevention, there is no definite way you can prevent autism spectrum disorders. We said for most reasons it's genetics, but early diagnosis and intervention is key. So as a parent, if you're concerned about the developmental milestones of your child, specifically towards language and speech and the way they're interacting with other children, you're advised to seek medical advice. And there are various centers you can go to seek help, specifically child development clinics. Yeah, and that's the end of the health talk.